Freudenberger with OakBend Medical Center, coming to you today, celebrating Men's Health Awareness Month of June. I'm joined by Joe Anzaldua, who has been a practicing family practitioner for now over 30 years.
41 years.
41 years. The man knows some stuff, probably more than we care to know. In any case, thank you very much for joining us, Joe. I'm just pleased as punch you could join us. And we've had some of our female doctors come in and give us perspectives on women's health. And I'm excited to hear about men's health and what we as men may need to do that we're not always thinking about. So what is it that you think, I mean, if you want to talk about men's health, what should we be focused on? You know, if I can spit it out.
That's okay. Well, first of all, thank you for having me. And you're right. The month of June is dedicated to bringing awareness to men's health, especially prevention and early detection of disease and examinations, evaluations, and even promoting healthy lifestyles. So that to me is all of those are very important when it comes to men's health.
Okay.
And so it's cool that we can celebrate it. We have our month to celebrate. So that's good. As far as the problem is that men unfortunately sometimes don't put their health first.
Yes.
We guys tend to think of ourselves as a breadwinner.
Yep.
We think of our profession. A lot of times we put our jobs before our health. And therein lies a huge problem because there's so much missed opportunity to get checkups.
And we're supposed to man up.
We're supposed to man up, yeah. And the problem with that is that it's a well-known tenet in medicine that the earlier you can detect something, the better off your outcome or your prognosis.
Right.
Especially in terms of cancer.
Yeah, absolutely.
A lot of times men tend to put that off, and therein lies a problem. So this month is to bring some light and awareness into that. So hopefully men will get more interested in their health and get more interested in getting their checkups.
Yeah, good. So what are some of the things that men tend not to do that they really shouldn't skip? That, for example, we talk about screening colonoscopies. 45 years of age, everybody, men and women, should get screening colonoscopies. Do men tend to do things like that more or less than women?
Definitely, they tend to do them less than women.
Okay.
And that's unfortunate because cancer is a big problem.
Yes.
Heart disease is a big problem.
Yes.
And unintentional injuries, including opioid overdoses and accidents on the highway, very, very important. But it's something that we tend to engage in more riskier behavior than women do, and at the same time, we just don't get our checkups and we don't go see our doctors.
So is it something I should do? Like, I haven't started getting regular checkups until I went over 60, Is there an age where you should start seeing your physician on a more regular basis for this early detection and prevention sort of thing?
Well, actually, in terms of just men in general, it starts when men are even kids.
Okay.
I mean, vaccinations and
yes.
eye exams and dental checkups. And of course, eye exam and dental checkups will occur
throughout your life. Absolutely.
And as you already pointed out, the new guideline is for men and women to get screened at the age of 45 for colon cancer.
Okay.
And the best test is still colonoscopy.
Okay.
Of course, for men, heart disease is important. Prostate examinations are important. And then a discussion with the physician whether a PSA is needed or is not needed.
Okay.
And that discussion is usually held with the physician.
Okay. Are there ages where these things become more important to focus on?
Yeah, I mean, I think 40 to 49, 40 to 50 becomes a very important part. Okay. We've already talked about colon cancer screening and then prostate cancer screening. We talked about eye exams. The other important thing is heart disease. To get screened for heart disease, get screened for diabetes.
Gotcha.
Check your blood pressure.
So getting those labs done on a periodic basis, even if you're otherwise healthy, feel great. Right. You're under 50, because I remember somebody telling me, like, high blood pressure is is a hidden disease. You don't even know you have it until you have an event. And so if you go and see your physician, they're going to be able to identify that and address it in a preventative sort of way.
Right. And that's part of the problem. We refer to it as the silent killer.
The silent killer.
Yes. Yeah. And, when you break your arm and you're in pain, you'll see your doctor and you'll do whatever they tell you to do because you're in pain. The problem with high blood pressure is that you don't usually feel it.
Right.
And usually if you're feeling complications of hypertension, it's usually already too far into the problem.
So let's talk about some symptoms that would be an indicator that I've got a problem. High blood pressure, as you described, as a silent killer. Are there any indicators that would tell me, hey, you've got high blood pressure, that would maybe trigger me to say, hey, I better go see a doctor about this?
Usually not, and that's the problem.
Okay.
But sorry about that. And usually what happens is that people will go to the drugstore to pick up some medications or toiletries, and then they happen to see a blood pressure machine and they check it, and all of a sudden it turns out they have high blood pressure. Or they go see the dentist and for a routine dental cleaning, and the dentist says, hey, do you know you have high blood pressure? And everybody's stunned because you don't feel it. Right. So sometimes that's how people become aware.
Okay. What other diseases out there might have symptoms that I will recognize listening to this podcast that I might not have otherwise recognized?
So we call those symptoms red flags. And a lot of times, if you have those red flag symptoms, it's time to go get checked out. Shortness of breath, unexplained chest pain, unexplained weight loss, abdominal pain that comes out of nowhere, low back pain. That comes out of, a lot of times low back pain cannot be your back. It could be the first sign of an aneurysm.
Really?
Or even pancreatic cancer.
So now you're getting really, really bad.
Yeah. So if you have unexplained back pain, it just come out of nowhere and it doesn't go away.
Most people have low back pain?
Yeah, but most people usually have it a recurrent or a chronic problem.
Okay, so it's episodic.
I'm talking about the man who just, for no reason, just having low back pain. There's no physical trauma, didn't engage in any exercise, wasn't lifting.
Got it.
And the pain's not going away. It's important to get that checked out. Unexplained abdominal pain.
Okay.
That's another red flag that many need to get checked out. Urinary symptoms. If you're peeing blood, I mean, those, or if you're voiding too much or voiding too little,
or voiding all the time.
Or voiding all the time. Yeah, I mean, those are also red flags. A man should say, you know what, I think I got to get this checked out.
Gotcha. I presume if you've historically been a good sleeper and you stop sleeping well, that would be another sign of something potentially amiss.
Yeah, it could be a sign of a lot of things. And one of the things that we see a lot these days is sleep apnea.
Yep.
People just don't sleep well.
Yep.
And then what they do is they don't sleep well at night. And then when they wake up in the morning, they're maybe already awake, but they wake up and they're tired all day.
Yep.
And just because they haven't gotten enough rest.
Okay.
Which actually sometimes can cause high blood pressure.
Yes. Yes. Everything seems to lead to high blood pressure. So are there things from a lifestyle standpoint that men can do that will help mitigate some of the potential diseases and other implications of getting older as a guy?
Yeah, sure. I mean, compared to women, we tend to probably drink more alcohol.
Yep.
Men tend to smoke more tobacco and probably do more recreational drugs more than women do. And those are all problems that can cause, those are all issues that can cause problems down the road. We also engage in more risky behavior. We tend to drive fast. We tend to engage.
Drive fast? No.
We tend to engage in sports that sometimes are kind of risky.
Okay.
And so as men, that's what we do. So sometimes that risky behavior puts us at risk for problems.
Is that like when you ride your bike? Is that a risky behavior?
That is a risky behavior, actually.
I bet you it is, especially in Houston.
Yeah, it's a matter of awareness. You got to be aware of your surroundings.
Yeah, absolutely. So mental health is often talked about, and I don't think we all take it as seriously as maybe we should. But why is it important for men to really be aware of the symptoms of mental health and to deal with it, and go see a doctor or what have you.
Right. Well, we talked about how men tend to ignore or put off physical ailments, but men sometimes that tend to put off how they feel emotionally, especially depression, thoughts of suicide, anxiety, stress,
Mm-hmm.
and we live in a culture where men just weren't taught we weren't taught to express ourselves, especially emotionally,
Yeah.
and so that tends to be a huge barrier.
Right.
But the one thing I tell my patients is that when you come to the doctor, this is all confidential,
Mm-hmm.
and you shouldn't be embarrassed about talking about stuff,
Right.
and be honest. How much do you smoke? Are you doing any illegal drugs? How much? You got to be honest with your doctor, and it's all confidential, and that's where it starts. It's communicating and finding a physician that you can communicate with and feel comfortable with.
Gotcha. All right. So, what sort of things would you recommend men do to, manage their health? I mean, obviously, do the opposite of all the bad things. Try and manage your stress. Don't drink as much. Don't smoke as much. Don't do risky sports. But are there other things that are things that men can do that will make a meaningful difference in their health?
Sure. I mean, we refer to that as lifestyle modification. And,
Gotcha.
and the two biggest things are, you know, get fit,
Mm-hmm.
get physically active,
Mm-hmm.
and just get a good diet.
Yeah.
Worry
Yeah.
about worry about your nutritional habits.
Yeah.
And if you're
Nutritional habits, not just your weight, your nutritional habits.
well, yeah, because you can have men that are not overweight and
Yeah.
eat very poorly. I
Ah.
mean, I got men they look fit and they have some of the worst cholesterols in the world. Well, they have the makings of heart disease.
Yeah.
So it's not always about weight. Sometimes weight
Really
doesn't correlate with high blood pressure or heart disease.
interesting. Because we're also fixated in the United States on weight,
Right.
but it's a much more nuanced reality that you're describing. That it's your diet. Are you getting the right nutrients? Interesting.
Yeah. So it's more than just weight. Even the other thing is genetics.
Yeah.
I mean, some people are very fit and do all the stuff, but their mother or their father, died of a heart attack at an early age. Well, those are risk factors.
Yeah.
So even though you're fit or you go to the gym a lot, you still have to get in and get your
Yeah.
checkups and get your cholesterol checked and get your sugar checked and all the other
Yeah, I knew a guy that
things.
worked out, swam routinely, went in and got a routine checkout, and they told him, "Man, your heart is in bad shape. You
Mhm.
need a valve replacement ASAP." And he ended up getting it, thank God. So, sometimes we need to get a little scared of, something that's not good. If we don't do, like some of these preventative things. Is there a story you can share where, without naming any names, but give us a scenario which says, if this guy had done this, he wouldn't have ended up here.
Well, I mean, after 41 years of practice, I mean, the stories never end.
Yes. Well,
Um,
give us a story that.
but I will give you one. So I
Okay.
had this gentleman, he's a Hispanic guy, and he would come in for his annual physicals very diligently, year after year after year, and I would tell him, you know, have you thought about that colonoscopy we want you to get? Nah, 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 I'll put it off. I'll think about it. We'll talk about it next year. Well, it was always the next year, the next year. He just didn't want to get it done.
Yep.
Well, the one year he made the mistake of bringing his wife. And so I mentioned to him, I says, well, have you thought about a colonoscopy? And he didn't know how to answer. His eyes got really big. He said, well, yeah, I haven't really thought about it. I says, we've been talking about you getting one for the past 5, 6 years. And her eyes just went, excuse me? You've been telling him to get a colonoscopy? And she goes to me, and she looks at me and says, book it, schedule it. He's going to get it done. He ended up having colon cancer.
Oh my God.
But the good news is that he caught it early.
I gotcha.
And then afterwards, he called me and just said, "I just want to talk to you a little bit." He was in tears. He says, if you hadn't been on me about this, I probably would be dead by now.
Yeah.
I said, so the take home message is, if your doctor's recommending something, there's usually a reason for it.
Yeah.
Look into it and follow the recommendations. And if you're not happy with the recommendations, get a second opinion.
Yeah. Absolutely. Well, that was a great way to end our conversation, Joe, because I think that brings it home. preventative health is not an optional thing if you want to live a long time.
That's right.
So thank you so much for joining us. Thank you for being a part of OakBend, being a part of our medical staff, and most importantly, taking great care of the patients in this community.
Well, thank you very much. Thank you for having me.
Thank you all for joining us for another Cup of Joe. Always informative for me, I hope for you. See you next time.